You're very welcome to today's update. Now, we're going to have a look at what's going on now in the UK and the US and the implications for other parts of the world. And if we get time, we'll look at what's going to happen in the next days and indeed months. We'll see how time goes today. Now, let's start off with the good news. The Medicines and Healthcare Products Regulatory Authority in the UK has approved the Moderna vaccine. So we've now got the Pfizer, the Moderna, and of course the Oxford AstraZeneca approved in the UK. The bad news is we're not going to get any of the Moderna vaccine till March, so it's not going to have any immediate effect. But it does show that the Medicines and Healthcare Products Regulatory Agency, MHRA, is being fairly proactive here, so that's encouraging. Now, unfortunately, that pretty well covers the good news for today. Today is not good. There's a lot of difficult things going on at the moment. Now, it's been announced by the UK government that you're going to need a negative test 72 hours before travel if you arrive in the UK. And we need to keep out this South Africa variant. Now, it's Friday today, so this is taking effect next Wednesday. A lot of people can travel in that time because we insist on flying around the world as almost not quite as normal, but we insist on flying around the world. 72 hours is plenty of time to become reinfected, and it's not specified whether this is going to be the more accurate polymerase chain reaction test or whether it's going to be the lateral flow test. We don't know that yet. So some might say too little too late. I would certainly say too little too late. The South Africa variant is a concern. We don't know too much about it. We believe it's more we know it's more transmissible than the old variant. How it relates to transmissibility to the 2012 Kent variant, we don't know. But we don't want it, whatever it is. And we know it's here. We don't know how widespread it is the problem. And basically there's no news on it yet, so I can't really tell you much more than that. So that's I suppose we could say the travel restrictions good, the vaccine is good. London. So London is declared, the Mayor of London, Sadiq Khan, I've just watched him on the news, is declared a major incident for all of London. He says the virus is out of control. And he says it's infecting 1 in 50 people in the UK, 2% of the UK. But in London, 1 in 30 people are currently infected. And he said in areas of London, it's 1 in 20. So this is really quite a serious situation. And if we look at the data from the COVID symptom tracker app for the UK, we see that there's nearly 70,000 new symptomatic cases today. That means the real number of cases is a bit higher, of course, because this is just the symptomatic cases, and we see the prevalence simply continues to increase. 8th of January, 824,139 people currently infected. It is a bad trajectory. Now, staying with London, 1 in 30 infected, 1 in 20 infected in some parts of London. Now, firefighters are currently been co-opted to drive ambulances, and the police are going to be driving ambulances soon as well, due to the severe pressures that the London Ambulance Service is under. Now, Sadiq Khan himself normally attends Friday prayers. He said he didn't attend them today, but apparently many are. So communal acts of worship are still going on. Now, this is just inexplicable and unacceptable. That Friday prayers are going on in many parts of London. Let's hope by Sunday there's no Christian services going on in London at all, other than online, of course, where it's always good to be online and get the encouragement from each other, but we simply cannot be meeting at the moment. The virus is out of control. 800 admissions daily to London hospitals. Now, Sadiq Khan said this: younger people being admitted to intensive care. Now, we don't have the stats on this, but there's been a lot of intimation from doctors and now from politicians that younger people are being more severely affected by the Kent variant, the 2012 variant. And of course, this is absolutely it's a major concern, isn't it? I mean, this is frightening. We're talking about young adults here becoming critically ill. This is a change from the first wave. This is really very concerning. And he said it's a pan-London crisis. So as of now, London is under a state of medical emergency declared by the mayor. And of course he appealed, as I do now, for everyone to stay at home. Do not go to meetings. Do not mix households. We are in an absolutely emergency situation now. And more on that as we go on. Where I live in Cumbria, the new variant is also very prevalent. It's about 75% in my area. In London, it's over 90% prevalence now with the new variant, the Kent 2012 variant. Now, just some general data from today, January the 8th. So cases slightly down yesterday. That was the last 24 hours. New cases had been just over 62,000 the day before, 60,000 the day before that. But I don't think this is any cause for celebration because the full lockdown in the UK was announced just 4 days ago. No, it was announced on Monday the 4th. Now, people were asked to obey the lockdown regulations from as soon as they heard the announcement from the Prime Minister. But it didn't become legally enforceable it wasn't legally enforceable till midnight on the Tuesday. So Wednesday was the first day of legal lockdown, really. So there's no. So this reduction. What I'm saying is this reduction is not a consequence of the lockdown. It's too soon. We wouldn't see the difference yet because of the incubation period of 6 days. So glad that's down, but it's not significant of anything, is what we're saying. Another 3,600 hospitalised. This is not sustainable. Now, 30,000 hospitalised there, 30,370, slightly down on yesterday. It looks like what's happening is non-critical patients are being discharged. This is just COVID patients, of course, are being discharged as soon as possible. Deaths yesterday, well over 1,000 yesterday, well over 1,000 the day before that. 78,508 deaths within 28 days of a positive diagnosis. So we're talking a lot about the bed situation in the UK. So what is the situation? Hospital beds in the United Kingdom. Now, this is the King's Fund, NHS Research Agency. General acute, mental health, learning disabilities, maternity and day-only beds. In the UK, we've got 140,000 beds. Latest data, 2018, 2019. General acute beds, we've got 100,000. Critical care beds, though, 5,900. This is the big issue. Critical care capacity. Mayor Sadiq Khan was saying that in London, instead of a 1-to-1 ratio between intensive care nursing staff, it's like one member of nursing staff looking after 3 patients. Now, in an intensive care situation, this is just incredible. I mean, I've worked on intensive care, and to look after 1 patient it is a full-time job in the intensive care situation. I mean, you've got very often the patient's ventilated, you've got to care for the ventilator. They'll have various syringe drivers going with different medications, perhaps a line in each arm. The medications need constantly topped up. The rates have got to be constantly checked that they're correct. The patient's probably got an arterial line, so you need to monitor their arterial blood gases to make sure the carbon dioxide is not too high, the oxygen's not too low. Some patients might require renal support, so they could be on various forms of hemodialysis. Patients might require cardiac support, so they're on special drugs that support the heart called inotropes. And then you've got the whole business of turning the patients. The patients need to be managed prone for quite a long period of time. Turning those patients is a multi-person job because you've got all the encumbrances of the lines and the tubes and everything. It really is a major job. You've got fluid balance to consider, urine output, bowel care. It's just 1-to-1 is a huge job. 1-to-1 is a full-time job. Normally you can manage it fine, but for one nurse to be looking after 3 patients, albeit with some support from people that aren't trained intensive care nurses, is not, well, we certainly wouldn't count that a safe situation, but that's what is happening in London at the moment. Anyway, additional beds, about just over 1,100 private beds that can be called on for the NHS as well. So that's kind of the overall bed situation, but nowhere near enough critical care beds for what we need at the moment. Acute bed occupancy in 1819, again the last full data set, overnight general and acute bed occupancy. Now it averaged at 90%, which is already high. So of the beds we had, they're already 90% occupied, and in winter it regularly goes up to 95%, which is a struggle. It really is a struggle. Now we're well over the 100% in many areas, and the trajectory is not good. So now, just to underline this, the NHS acute and intensive care bed shortfall by the 19th of January. Now this is an article from the NHS Journal, just published, was it today or yesterday? Yesterday, I think. Best case scenario anticipates a 4% increase, and in 2 weeks' time that's going to result in a shortfall of 1,500 critical care beds. Average scenario, 5% increase, that's going to result in a shortfall of 2,900 critical care beds, and the worst case scenario, it's going to result in a shortfall of 4,400 beds. People are already talking about 5,000 plus, so the worst case scenario in this prognostication has already been exceeded. It's unclear what's going to happen really. Now those figures already account for planned measures to mitigate demand and increase capacity, including opening up the Nightingale Hospital facility. So London particularly bad. We know patients have been transferred from London to other parts of the country, but other parts of the country are catching up now as the new variant of the virus becomes established all over the country. It really is tragic, because without this we would have probably been okay, but not with this new variant. Now just to reinforce this, so this is just from Our World in Data here. Now that's the 25th of December there, so that's Christmas Day, 25 December, and this is the number of new cases per million. So we see this blip here is not real. This was just a blip because the data wasn't collected there. But what we see is the cases are going up here. Each dot is a day. They are the increases per day, until we get right up to here where there seems to be a slight decrease. Whether that's genuine or not, we don't know yet. So we've got this increased trajectory here, and we've got the date along the bottom there. The problem is, we know that from when someone first becomes symptomatic to when they're likely to need hospitalisation, there's a 13-day gap. Now, these people have already had the infection, therefore they could suffer from the inflammatory complications of the infection that make people sick within 13 days. So it is now, and no vaccine is now going to help these people. So it is inevitable that a proportion of these will become hospitalised, and we're going to get this increase in trend over the next 2 weeks. It's going to mirror it at an increased level with a 2-week lag. So the patients getting sick then will be admitted then in 13 days' time. The patients getting sick then will be admitted then in 13 days' time. The patients getting sick then will be admitted then in 13 days' time. You get the idea. So unfortunately that's inevitable, and we have this phrase, these increasing numbers are now baked in, and it is unclear what is going to happen. Now moving on to the United States, let's look at the CDC trends. Now the picture at the moment is particularly bad in the southern states, especially for hospitalisation. So Arizona, I think, is leading the hospitalisation situation at the moment. California is not that far behind. And we have the data there for the particular. So average cases there. Actually, New Jersey is the highest in new cases, but Arizona is the highest for hospitalisations at the moment, we believe. And if we go on and look at the trends in the United States, well, it's clear we've got this post-Christmas, well, you can only call it a surge really in cases, and this is going to carry on as we predicted. Even after Thanksgiving it was predicted, but we see the gap in the data here is longer, and this is going to go up. And likewise, deaths in the United States continue to increase. So they're the CDC trends. Cases, last 24 hours for which we have data. Actually, that is the last 24 hours. That's the number. Officially diagnosed cases, up 8% in the last 7 days. We have been running at just under 8%. Now it's 8%. Testing remains pretty good, 1.6 million tests. Yesterday, up 4.6% in the past week. Hospitalisations, again, unsustainable numbers. That's intensive care, that's ventilated, that's the latest figure on deaths. Now, as we said, the southern United States is particularly bad. So, and Los Angeles County, particularly badly affected. So, this is a Methodist Hospital in Arcadia, Los Angeles. They've instigated crisis care guidelines. So what does this mean? Delivering the best care possible under the circumstances, which are horrendous. Forcing choices that may pose a risk to patients. We are not, or in this situation, they are saying they cannot give the care that they would normally pride themselves on giving. So this particular hospital has started a triage team. Triage is a term that goes back to the First World War. If you speak French, you'll recognise the word to sort, to organise, to sort out. So in a war situation, some people, you'd have to categorise who you're going to treat first. And sometimes in war situations, people that were badly wounded, if it was estimated that they wouldn't survive, no treatment would be attempted, because the resources had to be used on others who had a better probability of survival. This is where the triage terms comes from. Doctors, community members, bioethics specialists, spiritual care providers. Presumably, the spiritual care provider is one that is consistent with the individual's beliefs. Anyway, make the difference, but necessary decisions about allocating limited resources. So it's difficult, but people need to decide how they're going to allocate limited resources. There are other hospitals in California, Department of Public Health, which haven't been named, approaching or entering that stage. So that's a bad example, but we're actually into a triage situation there, with the triage team. And this is the United States we're talking about. This is pretty sobering stuff. Now, what's called B117 in the States is called the Kent variation, or the 20-20-12. It's all the same thing. It's this new mutant with the alterations to the 501 on the receptor binding domain. It's now in Connecticut, Pennsylvania, in addition to Colorado, in addition to California, Colorado, Florida, Georgia, New York. So it does appear that the improved tracking now in the United States is starting to identify that. How widespread it is in the United States, we still don't know for sure. Right. Now, I was going to look at the next sort of few months with the future of immunity, but I think we'll leave that for there now. For now. I'll gather my thoughts about that one, the future of immunity. I'll give you the bottom line on this. I've actually prepared this, and it's good. It's good. This vaccination program is going to work. We're going to look at some of the nuances of it there, but it is going to work. So the next 2 weeks is going to be very difficult. In the States, it's still pretty patchy. There's some parts of the States that aren't too bad at all, but other parts are in dire situations. And in the UK, it's not looking good, and we're being led by London, particularly, where things are particularly difficult. Now, on a lighter note, I'd like to highlight the incredible work of Joan McPherson from Scotland. Now, Joan has given away 1,100. She's made and given away 1,100 face masks. Now, do you recognise this tartan? Absolutely no reason why you should. It's the Campbell tartan. So she's made me a face mask in the Campbell tartan. Isn't that Joan? Thank you very much. That's really kind of you. But even more impressive, you've made and given away 1,100 masks. And this just shows that the community coming together like this is absolutely brilliant. And you might have noticed, the more observant of you, that Winston is also wearing a Campbell tartan mask, because I think he is a Campbell. He wears his upside down, of course, because he's a dog. And I noticed that Winston's also taking his vitamin D today, as indeed have I. I've taken 50 micrograms of vitamin D today. Sorry about that, but that reflects the nature of reality at the moment. But check on the next video. The longer term immunity is going to be good. It's going to be good. But for now, thank you for watching, of course.